Dr. Stephanie McCarter practices both internal and environmental medicine at the Environmental Health Center in Dallas, Texas. She was mentored by and worked 15 years with world-renowned environmental medicine physician, the late Dr. William Ray.
Hi, I'm Dr. Stephanie McCarter of the Environmental Health Center of Dallas, and I'm here to talk about EMF sensitivity treatment modalities. Before I begin, I just want to honor Dr. Ray. Dr. William Ray owned the Environmental Health Center, and we passed on his legacy to Dr. Seymour and I. And I just want to pay tribute with this talk to him, because if it wasn't for him, we wouldn't be doing this conference, I feel, because he was the one that started all of this. He did the first double-blind human study, one of two that are existing, in 1991. And I just want to pay tribute to him. And I want to just disclose that I have no financial or non-financial interests with this talk. And I actually want to start my first slide with Dr. Ray's total barrel, the total load, because this is so crucial to treating patients. This actually goes back to one of his first volumes in 1992 of his many books. And this is one of the most important points to make in treating these patients. If you look at this, there's air and water and food contaminants that are very numerous. And if you look on the bottom left, you have a high amount of electromagnetic fields, which in this particular year and day and age has gone extremely high because of 4G and 5G. And if you look at the bottom right, I added implants and tattoos because in our new generation of people that we're treating, there are over 220 implants today, and we have those made of metal and different acrylics, and all of this raises the total body load. So when this barrel is overflowing, every patient that you see with electromagnetic sensitivity has all of these things in their barrel that has increased. And so I just want to emphasize this point. Again, 75% of treatment is going to be about the environment. And you want to optimize your home environment for your patients, especially the bedroom, because the bedroom is where they need to sleep. When these patients get EMF sensitivity, they cannot sleep. And it is becoming increasingly difficult. Like in the city of Dallas, for example, we have thousands of microwatts in ambient level of RF. And so what we do is we try to teach the patient to make one room where they can actually lower those electromagnetic fields to the point where they can get some sleep. We know during this time in your cerebral spinal fluid is bathing the brain and trying to detox. So this is one of the most crucial things and why I started my talk with this slide. Our center has 5 times lower levels of pesticides, particulate matter, molds, and petrochemicals. So when patients come to our center, they immediately feel better. And so when you lower this load, it's so crucial. This is what we teach our patients to do in their home environments. And I just want to mention, we have all these great speakers that are going to be talking about biobiologists who help us to, lower the fields in our home and give patients instruction. But what we do with a lot of them is we tell them to get meters. Sometimes they can't afford to have a formal evaluation. And what we've learned recently is that the older meters are actually missing some of this 5G RF. And so we are recommending the Safe and Sound Pro meter for RF. And there's a Cornet now, Cornet Plus meter that does magnetic fields and RF fields and electrical. So we give them that option, but it's very important for them to either get a Safe and Sound Pro meter and then an Alpha Lab for magnetic fields, so that they can find a room in their house, preferably the whole house, but a room where they can have those fields lowered and they immediately feel better. So for dirty electricity, we also want to take that into account, and we oftentimes recommend the Stetzer meter, or they can use an AM radio on the lowest band. Sources of EMF products and biobiologists, many of them are going to be part of this conference. So I'm going to these are people that we like to use because shielding materials are very important. So we give our patients a lot of these resources. So number 1, we're going to reduce exposure. This is so important. And many of these patients have mold or metal or chemical or all of the above exposures. And so we're going to lower those. It's very important for patients with implants who have titanium, which is becoming so common, to realize that there's titanium in many of the products they're using, their cookware. So it's very important to educate your patients on lowering these things in their environment. Chemicals, pesticides, and of course the actual physical EMF fields. And so the number 1 and 2 things you can do is teach your patients to make clean air in their physical home with air filters, drink clean glass bottled water, and start an organic rotary yeast-free diet. So our detoxification is our goal. 80% of EMF sensitive patients are chemically sensitive. So that's one of the number one things we look at. And Dr. Seymour's talked about history and how important it is to find out their full history on exposures to this. So our goal is to help detox this, I call it the trifecta, chemicals, molds, mycotoxins, and heavy metals. A lot of people will think it's just one thing. It's always more than one thing. So I just want to emphasize that as well. So we have different labs that we typically get on our patients that we find are super important. We want to look at their minerals. You can do an RBC mineral analysis. You can look at hair analysis, heavy metals. Heavy metals I'm going to talk about a little bit more because the analysis is critical whether you're doing a provocation challenge or not. Toxic chemical profile, we want to look at all the different solvents. These patients never have something that's negative. They always have something. Glyphosate. We have so much glyphosate in our food, even in organic foods. So all of these contribute to the destabilization of the cells and the more sensitivity, which I'm going to talk about. Urine mycotoxins are crucial to look at. And then the cell membrane is affected in these patients, which is made of fatty acids and phospholipids. So we always check an essential metabolic fatty acid analysis. Heart rate variability is a very important tool and test to have, so you can get a baseline and look at how highly reactive their sympathetic nervous system is, and then you can follow treatment that way. So one of the most important things we know and we have learned is that the intestinal tract is the goal and to good health. And many patients come here after seeing many doctors where they've taken supplements, they're doing functional medicine, they've had elimination diets, and they're not getting any better. And what we have found is they have still hidden food allergies. They have to be much more controlled about which food groups they're eating and how often. And their gut dysbiosis is still out of control. And this is usually due to the fact that they've been exposed to mold and or metals. So I wanted to emphasize the fact that there's usually a lot of yeast, a lot of dysbiosis, and they have to be on a much more strict diet. And there's anytime inflammation in the GI tract, that they're having EMF symptoms and they have inflammation in their brain. So this is, besides avoidance and environment, this is the most important thing. We know the GI tract is one of the most important things you have to treat. So we use provocation neutralization at our clinic, which I'll explain, and we use it to identify all the different sensitivities to foods, molds, chemicals, metals, implant materials. If you don't have access to this type of testing, you can do serum levels of IgE and IgG for molds and mycotoxins and chemicals. Oftentimes there are false negatives with those tests, but at least you can have a way to identify the crucial triggers that these patients have. Because if you don't eliminate those or treat those, they're not going to get better. Sublingual therapy is an alternative to our treatment with the immunotherapy, and it is effective. It's also effective in children. They respond more so than adults, and so it's a good tool that you can have. I show an LRA panel on here, which is a test that we were hoping would be helpful for people who can't skin test, because they actually talk about being able to test, like provocation, all the different parts of the immune system and not just type 1, type 2. But unfortunately, I haven't had as much good results, but it's something you can try, because we find that the type 3 and type 4, the cell-mediated and T-cell-mediated immunity is a significant part of this sensitization. And so it's important to not just stress IgE and IgG. So the oxygen therapy that Dr. Von Ardeen developed, people don't know, he wrote the book Oxygen Multi-Step Therapy, and he was a fabulous, very smart physicist from Germany. He did a lot of work during World War II and found many different parameters. So what he was able to discover is that when the venous blood coming back to the heart is extremely high in oxygen, there's a lot of inflammation in the small blood vessels. So what he found is the endothelial cells lining these blood vessels are swollen and their sodium-potassium pump is not working. So he found that if you give oxygen for 2 hours a day, about 6 to 8 liters, after 9 to 18 days, there's a switch effect where that microcirculation opens up. And these patients respond so much to oxygen. But if you, like I said earlier, if you give a hyperbaric, sometimes it's just too much for their nervous system. And the nervous system is not like, a cut in the skin or a wound. When you basically trigger that nervous system that's already fragile, these patients have symptoms for quite a bit. They feel very miserable. So you have to be very careful. And so what we've developed here at the center is we've developed some non-toxic tubing and masks, and we actually made a non-rebreather mask out of cellulose and poplar. So we have a cellophane bag there. And so we don't have all the plastics, because when you get these patients that are electrically sensitive, as I said earlier, 80% of them are chemically sensitive, and they're very sensitive to plastic, and they have no idea. Also, when you have all this toxicity, you end up with co-infections. And we feel that, the environmental toxicities are primary, and then these co-infections are secondary. We have a lot of patients who come here, and they're being treated for Lyme disease. and they have EMF sensitivity. And I just want to point out that they're not getting treated for the environmental toxins and the mold. So remember, treat all of it. You have a lot of patients who come to you and they're fixated on, I have Lyme. And then when we do a solvent profile, we find they're loaded with solvents, or they have very high mercury and lead. Okay, so these are the different co-infections that we test for. And our experience so far, most patients that are EMF sensitive have a lot of problems with viruses. You can just see there's a big list here. But the top ones are Epstein-Barr, the Lyme, the strep, Candida, of course. And you can use these different immune tests to help you decide, if they have a high increase in their IgG titers, and then there's definitely something going on there. There's different antivirals that we put patients on. A lot of our patients don't tolerate medications, and even the natural, like antifungals. If you look at like Candida, you can do oregano oil, olive leaf extract, and they get tremendous die-off, and their EMF symptoms go through the roof. So you have to kind of go slowly with them. We actually start them on a Candida shot with provocation, and that's been really helpful. And we have some different viral antigens as well. And I don't have this in my slides, but I feel that low-dose immunotherapy is very beneficial for these patients. And we use the homeopathic doses to help desensitize to these different organisms. So that's another modality that you can use. And recently we started using ozone. Ozone has been wonderful for co-infections and helping to decrease inflammation. We're talking about IV ozone as well as insufflation. So it's a wonderful tool to combine with your other nutrient therapies. Proteus, Klebsiella, these are other things that we treat. And as you can see in my slides, I'm talking a lot about auto vaccines. And what we have learned is we use what's called an auto vaccine of the stool or the urine, or we can use it from the even tongue scrapings or the sinuses. And what we do with Autovax is we take that culture, and the pathogens that their body is having difficulty with will grow in the culture. There'll be an imbalance. And we can take that and then sterilize that, spin it down, make an antigen, and then help their immune system fight these specific organisms that their body's having difficulty with by using provocation and then treatment with this auto vaccine. I just want to talk about chelation, because chelation and EMF sensitivity is it's touchy. So when you have to chelate a patient, which is what you want to do when they have a high amount of heavy metals, you have to be very careful. And I like what Dr. Karazian points out, and that's in the slide, is that Cyrax panels can be used if you don't have access to what we do here. And that is to make sure that you're treating the food sensitivities and you're treating the gut and the blood-brain barrier. Because if you try to chelate someone who has, and especially if they have mercury fillings, you're going to run into some possible nightmares. Most people are fine, and people chelate many clinics do it with no problem. But when you have patients that are this sensitive, you can exacerbate their condition for months. I've seen disaster cases where that happens. So we want to make sure that they're, it's hard. You want to be patient, and I usually tell patients, we're going to start with IV therapy, and I have found to be very helpful is to increase their glutathione in their IVs, and where they're tolerating that, and then you're increasing that nutrient reserve for their glutathione and liver, and then you can do the heavy chelators like EDTA and DMSA. And also I find that if they tolerate IV alpha-lipoic acid, then these patients are going to be okay with starting chelation, because chelation is very helpful for EMF sensitivity. It's just the rate and the way that you do it. And some patients have to do very small doses. So it helps to have experience and just keep working on better to be slow and low with your dosing. And that's what I want to teach you. If they don't tolerate sauna, there's no way they're going to tolerate chelation. So that's a nice indicator to help you understand whether they're ready. So I want to present a case that is, I think, very helpful, because it's a young man. We're seeing actually 30-year-olds now, much more commonly. And he presents with a lot of different things that we are talking about. So he is a DJ in Vegas. So he's been exposed to extremely high electromagnetic fields in the physical part. He's got multiple tattoos, so we know we're looking for heavy metals like lead and mercury. Had a history of multiple mercury fillings, and he came to us. He'd already had those removed. And I just want to emphasize the fact that patients that are EMF sensitive, they cannot just go out and get their fillings out. You have to get them stabilized with nutrients and stabilize their gut. Otherwise, they're going to get much worse. He has an implant as well, titanium implant. Also, he had many traumas in childhood, and I'm going to talk a little bit about that, because sensitive patients have a lot of times subconscious traumas. And he smoked, so he has another toxin there. And he was in a accident with his motorcycle with severe concussion, loss of consciousness. And traumatic brain injuries definitely make people more prone to EMF sensitivity. So everyone has a story, and then they have an event or something that happens that really pushes them over the edge. And in this case, for this young man, it was he moved into a moldy home while he was in Vegas and immediately started becoming EMF sensitive. He developed anxiety, difficulty sleeping, ringing in his ears. He started noticing every time he used his phone, it got worse. Every time he was around power lines. And it's interesting, people are not educated in the physical and the medical field, and it's unfortunate because these people think they're going crazy. Many times they go to the emergency room and the doctors just give them something like what we're seeing right now is a lot of Klonopin or sleep meds, and so they're not getting treated properly. So the symptoms get a little bit better, but then in his case it got worse after a while, so he started having vision loss because they're staying in this environment that's making them sick. So unfortunately the medications make that worse. He started having tremors, he started having a lot of confusion, brain fog, his balance was off, weight gain, fatigue. They say, a lot of them say, I was feeling wired and tired. And then he noticed his blood bleeding of his gums, so we're knowing that his gut's starting to be affected, and skin burning, his face was flushing. This is very common, and a lot of the patients describe this. They say, 4 or 5 years ago, I was noticing that sometimes when I was on my phone. So that's a critical thing to not ignore, which many patients, because it's not happening all the time or they get medicated, they just keep doing the same thing. On his physical exam, he had a heavily coated tongue. I always look at that because that's a nice indicator of what's going on in the gut, especially the colon. And most of these patients have this. And when they have a heavily coated tongue, then they have a coated colon. And there's a nice biofilm for all those pathogens, right? He had gray hair at such a young age, so we know he has low minerals, multiple tattoos. And we do a Romberg test and we do a tandem gait test with the eyes open and closed. And what we have found is when we have them close their eyes, and some patients even with their eyes open, they cannot keep their balance. So what happens, we've learned through Dr. Ray and all his years of experience that when you take away vision, the proprioception and the cerebellum cannot compensate. When that happens, that's a big tip-off that you've got some kind of neurotoxicity in the brain. So I just want to make sure you understand that. So on his labs, he had high IgE. When we see that, usually some foods that are being missed and oftentimes mold. He had a high venous blood gas, so he's going to need oxygen therapy. So we know he has microcirculation inflammation. He had actual normal T and B cell counts, but when we looked at the functional test on his arm, he had no function of his T cells. And fortunately for him, he had normal IgG subsets and complement. And then we also look at ANA because we find that becomes abnormal in patients, and people get really worried about it. But what we have seen with treatment is that gets back to normal, and that's the deregulation of the immune system, right? Because it's being that total barrel, that barrel's full. He had a normal SED rate. He'd been eating organically. He had started looking into healthy living. So his glyphosate was actually in the 40th percentile, but it was still positive. And he had normal hepatitis profiles. We always like to look at the heart rate variability. And if you look at him, he's got the typical picture where he's got a high sympathetic, increased sympathetic activity, and decreased parasympathetic activity. So his body is in fight or flight mode most of the time. So these patients, when they're like this, they can't rest and digest. If you look at his fitness and his ability to adapt, he's supposed to be up here, and he's getting towards this, highly low fitness and decreased ability to adapt, his nervous system to adapt. And then his chronic vasoconstrictive ability was decreased. So that's pretty common when you see that you're going to see a high venous blood gas because the microcirculation is not able to, when a person stands up, it's not able to compensate. It's inflamed. His thermography, we see this all the time in EMF patients. They have abnormal brain points. They have lymph system that's not working. And as you can see, it's one-sided. Just want to point out the fact that when patients come in, a lot of doctors think there's something weird because they describe everything as one-sided. But when you remember anatomy, your autonomic nervous system is one-sided. So this is something to remember because we always think about it crossing over, that they're going to have something on one side and it's affecting the opposite side. No, these patients have a lot of one-sided because it's the autonomic system that's affected. We always see this liver and pancreas, GI tract are toxic, and he has a lot of yeast. And in his situation, he's got toxic kidneys. So again, you want to be careful with chelation because you can really affect the kidneys. And then his sacroiliac joints. So all the communication areas of his body have been affected. This is just a picture of the recording of his CMI test on his arm. So you see none of those came positive. We had no positive wheels. So when we look at his urine mycotoxins, I apologize, this is kind of small, but he has extremely high gliotoxin and he has high aflatoxin. So these mycotoxins affect the intrahepatic circulation. They affect the gut and malabsorption. They cause villus atrophy. So he's got and they affect the nervous system, multiple systems. And we find a lot of times the gliotoxin gets higher because they have a lot more yeast. So when they've been in the mold, they get more yeast, and then it kind of snowballs as far as the gliotoxin levels. He had high PCBs on his toxic core profile and very high solvents. And this is very common. We see that. You know, he has the highest benzene, ethylbenzene, styrene. A lot of times we'll see xylene because his mechanisms are not working. So the body, unfortunately, in this day and age, we have so many pollutants out there, it starts just accumulating. And this is, again, affecting that cell membrane. It's affecting that EMF sensitivity. So if you look at the atrazine level, I see this all the time because it's in the water. Dallas water, we filtrated it 3 times and we still have 20 chemicals. And then here's glyphosate level. So when he skin tested with provocation, we started looking at, okay, look at this. On his mold mix, a lot of his EMF symptoms were instantly reproduced when we put that in on his arm and started seeing if he was sensitive. And I just want to point that out. And then he also, the chelating agents, many times people don't realize it, but people are very sensitive to the agents. So the higher this bottom number is, the more we had to go dilute on his arm to find an endpoint where he wasn't reacting to it. And so we used that then as his treatment dose, and we started desensitizing him to those chelators, as well as the molds. And if you look at titanium alloy, he's very sensitive to that, and that's in his body. So he's constantly, that ground regulation system is constantly depolarizing and inflamed. And so how can you not be reactive when that's happening? And if you look at mycotoxins, unfortunately, mycotoxins get stuck in the body because they're so tiny, and people tend to be very high on those endpoints. He's a 9, so he's got that in his body. And so this will be his treatment dose, and it actually will help his body, his cells see it and start to detox it. And actually, titanium was not as strong as the alloy, and we see that a lot. So essential fatty acids, he's low on his omega-3 linoleic acid, so he needs more DHA, fish oil. And this is a wonderful way to help these patients. So he's pretty good on his omega-9s and his saturated fatty acids. A little low on some of the palmitic acids, so he needs a little bit of organic meat. We have to be careful because cheese and butter are good for that, but we have to be careful with cow's milk. It's a pro-inflammatory, so we see how they skin test. I like the way that the Doctors Data does their testing, because you can look at each step in the conversion for their fatty acids, and you can see the cofactors that are essential for these different enzymes for these different steps. So you can say, in his case, I want to just jump ahead to his omega-6s. He's very low on omega-6 linoleic, and he's very low on his DGL, but he's high on arachidonic acid. So in his situation, if you look at the Doctor's Data chart, he's very low on his omega-6 alpha-linoleic acid, but he's low on DGL. So he is not getting the anti-inflammatory fatty acids, and he was high on the arachidonic acid. So he's having a lot of pro-inflammatory fatty acids. And I like the way they do this, because you can look at the different enzymes and say, oh, what cofactors does he need to help increase this step? And he needs the source also, which is the evening primrose oil, borage oil, the omega-6 oils like blackcurrant oil. And so you really help these patients establish that cell membrane and those phospholipids and fatty acids. And that's that insulator, so it's super important. And then over here, you've got another anti-inflammatory. This is helping the prostaglandin PGE3. And you say, oh, well, what cofactors does he need? He needs B6, he needs P5P, he needs vitamin C. And so this is a wonderful tool that we have. So we started him on all these different antigens for molds and chemicals and metals. We started him on the chelators, food, dust, candida, and he started IV nutrients. We did those 2 to 3 times a week, and we start with the high dose vitamin C, glutathione, magnesium. We give a lot of magnesium. As I said earlier, vitamin C and magnesium are crucial to that redox potential of the cell. Trace minerals, B complex, taurine. And we started him on sauna with lymphatic massage a couple times a week. He started his oxygen therapy. It's important, if you can, to have them do 18 days sequentially and not skip days. And after about 2 weeks of this and on the antigens, we started a provocation test for heavy metals. And this is his pre-chelation urine metals, or minerals, I'm sorry. Minerals, he's low in copper, he's low in vanadium and chromium. And so we started supplementing those as well as the regular trace minerals. And then if you look at his pre-chelation urine metals, so this is, if you were just to get a urine analysis of metals, you don't see anything in the yellow or the red zone. And I always tell patients that if they have positive on these, I'm sure that if we chelate, we're going to see, increased excretion of this, because the chelators really pull these things out of the tissue. And in his situation, that's exactly what happened. We gave him IV EDTA and DMSA orally, and he has all this lead coming out of his body. So we continue to chelate these patients and replenish their minerals. The more sensitive they are, the more they need IV minerals in between chelation. But we continue until we get all of these. You see he was high in aluminum, he was high in cadmium, he was high in thallium, tin, and thallium is becoming a big one that we're seeing on cesium because of the radiation, unfortunately, that's in our environment. And if they have extremely high thallium, we oftentimes give them Prussian blue. And we're also seeing a lot more gadolinium because so many patients are getting diagnosed over and over again for really what's EMF sensitivity that's actually, they're getting MRIs with all these contrasts. So they're making the whole thing worse. So I just want to make sure people are aware of that. So he moved to Oregon from Vegas, and he went into a wooded area where he was able to have a lot less EMF sensitive exposure, especially RF from the cities. He was continued on his immunotherapy. He was able to get his ALF started. That's the immune booster that we developed. He bought some meters and made sure his bedroom was really low. And he started some different meditation and grounding type therapies. Craniosacral therapy is so important for patients that are EMF sensitive. If you can find a good therapist, because the cerebrospinal fluid is always not, its pulse is 12 times a minute, but it's always off in these patients. And these treatments really help reset their system. And after about 8 months, he described that he was dramatically decreased in his sensitivities. His brain fog and memory were much improved. His Romberg was back to normal, and he had no more rashes or burning of his skin. So this is a wonderful story, and he's continuing to improve rapidly. I want to just talk real quick about energy centers. Patients that are EMF sensitive, their energy is stuck here in these upper chakras. They don't have any root or grounding. And so grounding exercises and teaching them this and being outside on the earth with the electrons, whenever there's negative electrons, they're going to feel so much better. And it's an important part of the treatment. And illness is always due to some of the kind of decrease or abnormality in this flow. So I just want to talk real quick about, so these are the different things we can recommend for our patients because it's helping that energy block. That's what's happening to them. The bottom three that you see here, the laser frequency, microcurrent, PMF, these are wonderful very low electrical, electromagnetic energies. It's like, 0.3 to 30 hertz, or on a cellular level. You still have to be really careful with these patients. When you try these therapies, you can really set them off. So you want to start 2 minutes, you got to go very slowly with these patients on this type of treatment. So one of the things I want to mention, it's the last and most important thing, is that people who are chemically and electrically sensitive are very sensitive in their limbic brain. So we have found that the limbic brain has a lot to do with physiology, and so we are very emphasize EMDR, thought field therapy, emotional freedom techniques, anything that will help them with their amygdala. These patients have highly sensitive amygdala and limbic areas that say, I'm in fight or flight, I'm in fight or flight. And it has a lot to do with what they experienced earlier in life, but it is very real. Dr. Feinstein did some research and he wrote a paper in the psychology journal about reviewing different EEG and MRI, functional MRIs and PET scans. And when they looked at tapping on these meridians and acupressure points, they actually saw that the amygdala depotentiated in its stimulation, and there was increased delta waves in these patients, and that decreased the fear memory centers of the brain. It also affected their glutamate receptors, and I have seen this happen. I feel it's really important to emphasize to physicians that are treating these patients, they're going through so much. It's like post-traumatic stress, just dealing with all these sensitivities and this environment they're in that's nonstop Wi-Fi now. So it's important to help teach them how to desensitize their limbic brain. I think if you don't do this and you don't work with that part of the brain, you can do as much physical detox as you want, and they will not get better. They will be very slow to improve. So I just want to make sure that people understand this. So summary, we have reduce exposure, get environmental control. That's 75% of it. Teach your patients. We're going to help their immune system by getting their nutrient deficiencies corrected. We're going to build up the immune system using immunotherapy, and immunotherapy in our situation helps to detox them. That's super important. So detoxifying of chemicals, molds, heavy metals, giving them oxygen. That's going to be crucial in many patients. Treat the co-infections. We have had patients that have done the first 5 steps and they're better, and then suddenly they're extremely better after we do treatment for the viruses and the different pathogens. Teach them how to ground, teach them how to slow down. Just doing meditation and yoga helps bring that parasympathetic system forward because all these patients are in hypersympathetic mode. And then emotional limbic retraining of the brain, using those different modalities, and you will get your patient well.